Connie and I are in our mid-60s. We both have had long careers that we loved, and Connie has recently retired from her public school teaching job. We've always had health insurance. We've been on Connie's public school teacher insurance plan, and after she retired, we switched over to my employer-sponsored plan. The year before that, she enrolled in Medicare, even though she was still on my plan. I was about to turn 65 and was wondering whether or not I should enroll in Medicare since I was going to continue to work because I love my job. We called our financial advisor, Kurt, and asked him if he could stop by the house to chat about our options. Kurt came over and we just had to show him the new patio we'd been working on. As we drank iced tea outside, Connie and I asked Kurt to talk a little bit about how Medicare would work with my employer-sponsored coverage. Kurt explained that in general, my group health plan would pay all medical bills first up to the plan's coverage limit. After that, Medicare will pay any additional costs up to the Medicare-approved amount. Finally, Connie and I would have to pay whatever costs Medicare or the group health plan didn't cover. Seemed pretty simple. Then Kurt wanted to know how many employees my company had. He told us there are different rules for employees of small companies, those with less than 20 employees, versus larger companies, those with more than 20 employees, for who should enroll in Medicare and when. I work for a large financial services firm with a generous employee benefit program. Kurt thought about it for a moment and explained that because of the size of the company I worked for, I could delay enrollment if I wanted, but there could be some penalties down the road when I did want to enroll in Medicare. Then I shared with Kurt what the Human Resources Department had told me when I called about Medicare sign-up. They said that if I signed up for Medicare now, that I would no longer be able to contribute to my health savings account. They also stated that I could stay on the company plan as long as I was actively working, allowing me to contribute to my HSA, and then they would send a letter to the government that would say once I had retired that I was now eligible for Medicare sign-up. That would help me not have any penalties for not signing up now. Kurt appreciated that update and made a note of it. Then I explained that I wasn't sure how much longer I really wanted to work full-time and was looking for an option that would allow me to begin to scale back my hours or even think about officially retiring someday in the near future. I wondered if enrolling in Medicare now would give me those options. Kurt suggested that I might consider enrolling in Medicare in the 3 months before, during, and or after my 65th birthday. That way Connie and I would both be enrolled in Medicare, even though our primary medical benefits would still come from my company. Then, after my group coverage ended, we wouldn't have to worry about things like COBRA or any enrollment deadlines or penalties. That way I could compare all options to see if contributing to the HSA was more beneficial over time or if I should sign up for Medicare now. After Kurt left, Connie and I talked a little bit more about what retirement meant to each of us. I laughed and admitted that I had been feeling a lot of pressure to continue to work because of our healthcare option available through the company. Knowing that I could enroll in Medicare now, while I was still working, helped me to feel more confident about my healthcare costs in the immediate future. Connie quickly pointed out that it would also allow me the flexibility to shift to a part-time schedule if I wanted, and I could spend more time working with her in the garden, something that we both love to do.